Hello, my name is Devin, and I am a physical therapist. I have been a traveler for the last 8 years, and I've gotten to experience a number of different settings. First, skilled nursing facilities, acute care hospitals, outpatient clinics, and home health agencies. And in my travels, I've kind of determined what works best if you're going to be a travel therapist. Things that you should really think about who you are and do you connect with being a travel therapist, and what makes you excel as a travel therapist. And number one is I think you need to like adventure. You need to, because you're going to be packing up and moving every 3 to 4 months. You're going to change your work setting, your community, the friend group you're going to be around for the next 3 to 4 months. It's going to change quite rapidly. So you got to embrace that adventure piece. Another thing you should think about if you want to be a successful travel therapist is you need to be flexible and adaptable. You're going into, I like to think if I'm going into somebody's work home, so to speak, and I am their guest. I'm there to help out. And so you're going to be learning new documentation standards, productivity standards. You're going to look at different workflows, and instead of trying to impose your will on their system, you need to adapt and be flexible to their system. That'll help. It just smooths things out so much. Another thing that's important for you to be a good travel therapist is proactive communication. You need to be somebody that seeks to understand what is required of you. The most trouble that I've gotten into is that I haven't really understood what the expectations were for like productivity or documentation standards. And now I've learned that after about a week, I actually seek out that feedback. I go to the rehab director and I say, here's my daily notes and here's my evaluations. Does this match what you're looking for? Because every department has its own little things that they want to focus on. And it varies from home health to acute care to the outpatient clinic. And to get that really defined is helpful. I think an important part of being a travel therapist is humility. You have to look at this as an opportunity to learn. And you're going to grow as a therapist here if you have really a focus on being open-minded. And I think as I've been at this, a total therapist for about 19 years and traveling for 8, and I went into it with a bit of a chip on my shoulder. It was like, well, I'm coming in, I'm the guy that's the expert because I've been doing this for 11 years. But I have really changed who I am as a therapist and grown by taking a humble approach and saying, what can I learn from this group of therapists? Because every different therapy group can teach you something, whether it's about a treatment progression, treatment techniques, organizational skills, documentation. You're going to learn something if you have a humble approach. One of the things I really like about being a travel therapist is I get to meet new people and I get to learn. It's a great opportunity. I am such a different person just from a therapy perspective, but also a person, because now I have a full breadth understanding of what it means to be in rehabilitation. I can see now a patient in the acute care setting and I can anticipate what they're going to need in the home care setting. I can even tell them what to think about and prepare for the home care visit. And then also I can take that home care and say, this is what outpatient's going to look like. So I have experience with the whole continuum. And if you take advantage of different settings that travel therapy has to offer, it's just going to be a boom to your career. The other thing I love about being a travel therapist, I get to focus on the therapy. You get to stay out of the office politics. You get to stay out of the, the complaining that's going on, and you can just avoid all of that because you're going to be gone in 3 to 4 months, and it's not really an issue that you have to deal with, and you just get to focus on your patients and delivering good quality care.